A paper by Basal looked at lumbar spine instability, and the goal of this paper was to review the history of lumbar spine instability and then look at what the current evidence is. What they found was that the first published article was by Barr in 1951, and he hypothesized that degenerative discs were the cause of low back pain. And essentially what the theory was is that with the loss of disc height, there would be instability and pain. And so basically what that means in a model is that if the blue band here are the passive structures that are providing stability around the joint, and then in between my hands is the disc, with the loss of disc height, there would be more motion in the joint, and that would lead to pain. And then fast forward a couple decades, in 1977, Farfan and Gratvatskowski, which is probably a complete butchering of that name, but they made a model based on a weightlifter, and they found that those passive structures surrounding the discs are better at minimizing compression versus shear. And so again, if we're looking at it, compression would be this way, where shear is this way. And so that kind of further elaborated or further supported that original study by Barr. And then finally in the 1990s, Punjabi published 2 articles, and they were on spinal stability. And basically in his theory, there's 3 different subsystems that encapsulate stability. There's the structural system, which is passive stability. There's the muscular system, which is active stability, and then there's neuromuscular control. And then fast forward to today, the Basal study found that other studies have provided additional support of these original studies on lumbar spine instability. An MRI study found that both disc and also facet degeneration have a positive association with increased translation, whereas just facet degeneration actually has a negative association with angular movements in the spine. And then for the diagnosis of lumbar spine instability, the Basal study actually references a Delphi study, which is a consensus statement with a bunch of different individuals that come together to make a statement. And for the history findings, what they basically suggested is that people with lumbar spine instability report some sort of aberrant movement finding. And what those were pain with flexion and extension. They might have a climber sign where they're using their hands to walk up their thighs when they bend forward. There's pain with transitional movements, so either from sitting to standing or standing to sitting, or pain with some sort of sudden movement. And then for physical exam findings, the Basal study references some orthopedic exams that were actually mentioned as the clinical prediction rules. And so we had a prone instability test where somebody would go on a table and they would hold onto the table with their legs hanging off the table, and then you would apply a P to A force through the low back and see if there were pain. And if there is pain, then you would lift up the legs, activating the paraspinal muscles in the low back, and you would press again to see if it reduces the pain. There was also the straight leg raise, which doesn't necessarily have to be symptomatic, but the straight leg raise has to be over 91 degrees. And so those were a couple of the tests that were mentioned in this study for lumbar spine instability. And when looking at the results of this study, I think that we need to provide a little bit of context. And the problem with some of these degenerative findings is that we see them in asymptomatic populations. And so now when we typically explain this to patients, we like to say that it's more age-related and that they're coincidental findings and that they're not actually the reason for low back pain. But when we look at this study, it's interesting because the degenerative changes actually might have some biomechanical consequences, which might lead to some sort of pain syndrome. If we have a little bit more shear in the joints, there are abnormal loads that are placed on it, and that can lead to some sort of pain production. And so we need to be careful that the pendulum doesn't swing too far, and that all disc changes they're age-related changes, they're normal, that's just part of the process. They actually might have something to do with the biomechanics of the spine, and they might actually be contributing to pain, We just don't know necessarily how much they actually contribute to pain and why some people with these changes have pain and some people with these changes don't have pain.